More than ever, social workers are on the front line of a mental health crisis, battling against the tide of chronic income inequality that has driven countless individuals into homelessness. In this critical moment, the call to action is clear. Social workers must be the voices of hope and resilience as Jane Addams, leading the charge as we confront these multifaceted issues head on. This documentary explains the roles of different types of social workers, the populations we serve, and how we help, while showing compassion and action through the lives of real social workers. I was able to reach out to the social worker community, seeking to understand what type of social work they do in their jobs and whether they have a call to action.
Okay, so currently I am a medical social worker. Actually, it's kind of different because I'm a hybrid. I do a couple different things besides medical social work. We provide a lot of resources, a lot of information. We help with next of kin. We help with guardianship, oversee some mental health court. We've had to do death notifications, things of that nature. Social work in general, I like the networking and I like our resource base. You always have someone in some field, some profession, somewhere in some state that is able to offer you some type of help or assistance. Even if you're limited where you are or in your resources or what you know, there's always someone else that knows more and that is willing to help you to increase your knowledge base and your ability to service your clientele. I've worked with children, with gangs, I've worked with pregnant teens, mental health for adults and for children, hospitals, schools. I've worked in the jail system. Each role has its limitations.
The profession of social work has evolved. The multifaceted hats that Jane Addams wore are now divided into different social work positions. We are the heroes of our community. As our nation grapples with systemic challenges, we stand ready to transform empathy into action.
So what do you do? I'm a police social worker with CCSD. I'm compassionate about incorporating mental health into law enforcement and bridging the gap that we see when a student doesn't meet criteria for a citation, ensuring that the student's mental health needs are addressed, and ensuring that appropriate mental health referrals are made and the family is connected.
In these pressing times, do you have a call to take action on the issues pressing for your clients?
I think it's important that we address the mental health concerns of youth who are involved with law enforcement but maybe aren't meeting the criteria for a citation or arrest. There's a large need of students who kind of fall between the cracks. And with working so closely with law enforcement, we are able to bridge that gap.
With everything going on with immigration and social workers being let go from Veterans Affairs, who's helping with the homeless, what do you think about some of those issues?
I think it's tough because there is a need, and with funding being cut, it removes some of the positions of people who are set in place to help. We're seeing within the district that there's a lot of funding cuts that are being made, and that's affecting the jobs of social workers who are there at the schools to help support the children's mental health. And without those positions, we're going to see more of a need.
When you hear compassion plus action, what comes to mind?
Creating change for individuals, for children, not just within CCSD, but within the Las Vegas Valley, and making sure that they have support and access. There's wonderful mental health resources that the school district does pay for that we can utilize to help get children in touch with therapists who can support their mental health crisis. I'm a social worker. I am compassionate. Happy Social Work Month.
Hello, my name is Janice Wiggins and I am a social worker. I work primarily in macro social work. My clients are organizations, entities like nonprofits, small businesses, government agencies, faith-based, basically organizations that make a social impact and a positive change in people's lives. So I'm passionate about large-scale impact with organizations primarily and within communities. I've worked in direct practice as a social worker, and what I found is that I would ask myself questions about why are policies the way that they are? Why are these certain rules or regulations in place? And who makes these rules and or regulations and policies? And can they be changed? Can I give input from my professional standpoint? How do clients give their input about these policies? So in these pressing times, I would say that my call to action would be keep going. Keep going, push the envelope, ask those questions, advocate on behalf of large community change. I like to see how can we really make a positive impact. So whether it be speaking and testifying in your state legislature, going to a city council meeting, maybe going to a county commission meeting, making your voice heard so that you can advocate not only on behalf of yourself, but also your community as a whole.
Recognizing the delicate nature of social workers' roles within Veterans Affairs, we didn't conduct formal interviews, making sure to put privacy first. However, we took the time to listen to heartfelt concerns of the social workers. They are the brave individuals who have fought for our freedoms and deserve the benefits they've earned. It's deeply troubling to consider that these essential services could be affected by the layoffs between the federal government in 2025.
Who's going to take care of the veterans? Now, you start cutting that staff, you're going to have problems. We're already 90 days out to see your primary care physician. How much longer are we going to have to wait?
We have found that social workers are being tested, and it is not the first time. The issues we face today are problems we have fought and won before. If we do not take action, we will not have a say, and the benefits we fought for our clients will be lost. Yes, we are afraid of losing our jobs. We question if the work is worth it. The stress mounds of paperwork, low wages, and long hours all begin to take a toll. Then our government asks if we're making a difference. Many positions in social work fall in the gray areas. The government says they cannot pinpoint which agency or what made a difference. Was it mental health, counseling, doctors, or medications that stopped the clients from using drugs, which lowered the homeless? The bottom line is that social workers help advocate for all of it. Despite the challenges, we show remarkable resilience. We have faced layoffs and scrutiny from the government, but we have not faltered. We rise, we stand, we fight another day, stronger and more determined than ever, advocating for clients and their families. So we know that this is not the time to sit and watch. It is the time to write letters and call legislators at a state and Congress level. Speak out or be spoken for. We are not just social workers. We are strong, we have compassion, and we are proud to be social workers.